Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Kim Downey. She's a physician advocate, and she brings us Ava Safir. She's a registered dietitian. Their Kevin MD article is Why Patients Need a Registered Dietitian on Their Healthcare Team. Kim and Ava, welcome to the show.
Thanks, Kevin.
All right. So, Kim, every month regularly we have you on and you bring people who are important to medicine to the cross section of medicine and various other disciplines. And today you bring us Ava Safir. So tell us about how you found her and what about her and what she's written. How does that resonate with you?
Sure. So this one is personal, and I think I've mentioned to you, Kevin, that I had surgery in December, and after that, I had some lab numbers that were quite concerning, and my primary care doctor thought perhaps he'd have to add in another medication. And because of my other cancer surgeries and a complication, I'm on other medications, and
Mhm.
I never wanted to be on any. So my goal, I always want to try to reduce them, not add medications. So I asked him, I said, and I think I know, a fair amount about healthy eating and healthy lifestyle. And I said, but maybe there's something that I'm missing because that's not my particular area of expertise as a physical therapist. So I said, could you refer me to a dietitian
Mhm.
and maybe there's something I don't know. So he did, and he referred me to Ava. And within a short period of time, we got to meet. She spent over an hour with me, and she did help me learn some things that I hadn't been aware of. And I said, by the end of the hour and a half, I said, this is great. Are you inundated with referrals? And she was like, oh, it comes in waves.
Mhm.
And I thought, well, a lot of doctors need to know how
Yeah.
valuable this could be for like them and their patients. So driving home, I was like, how could I let more doctors know about this? So I think by the time I got home, I might have asked her if she wanted to collaborate on an article so we could get the word out.
All right, wonderful. And that story really resonates with me. I'm a primary care physician as well, and there's so many conditions that can be treated without medication and just with dietary interventions. And I often send patients to registered dietitians like Ava, but sometimes I actually don't know what actually happens in the room. So I'm hoping that Ava can shed some light into that. So Ava, you're a registered dietitian. Tell us first a little about yourself and then the article that you wrote on Kevin MD.
Sure. So I'm a registered dietitian. Sometime in my late 20s, early 30s, I was having some medical issues that I was struggling with. And I came upon a doctor who really took a more lifestyle approach to the condition. And she made some significant changes to my diet. I thought I was generally a healthy eater. I exercised regularly. I kind of, Kim, like you, thought I knew what I was doing. But the changes that she made a significant difference, not only in my lab values, but in how I was feeling. So at that point, I thought, I'm in. So I'd like to go back to school. I became, I took all the coursework and became a registered dietitian for the same purpose of, why Kim came to my office.
So tell us about the Kevin MD article that you wrote.
So like Kim said, she came in and she asked about, or she said at the end, basically, are you inundated with patients? And I said, as a small business owner, we often have to pull back the lens and see where our referrals are coming from,
Mhm.
how are clients getting through the door. And we often find it does actually come in waves. For instance, this month we seem to be getting quite a few referrals, last month not so much. And sometimes it's hard to really get a handle on why that's happening. So when working with Kim, we decided to, talk about the benefits of a registered dietitian as sort of being part of the medical team.
Mhm.
Doctors often have, 15-minute windows, 20-minute windows to really spend with their patients. You have a lot to get done in that time period. Whereas we as dietitians, particularly in private practice, have at least an hour.
Yeah.
We sit down, we go through people's entire medical histories, their medications, their supplements, their lifestyle habits, their goals, all of that type of thing. And sometimes just in having conversations with people, things start to pop out, things that you may not have gotten just on an intake form. And so that really benefits us when we start to work with folks towards their goals, particularly towards their lifestyle habits. And, I'm a big proponent of the idea that, medicine is great.
Mhm.
Thank God we have medications. Thank God for Western medicine. But there's a lot we could really do for life with lifestyle factors, from diabetes to heart disease to gut issues. There are so many things we can do in the food realm, exercise, stress reduction, sleep, all those types of basics that can really improve a person's quality of life. And so it's really important for me as a dietitian to allow doctors to know we're here for you. We're here to collaborate with you. We're here to answer the phone, go back and forth. I always send my notes to any referring physician. And let's really try to get these patients the best outcomes that we
Mhm.
can by working together.
So, Ava, what are the most common referral reasons that you get from physicians? What are the most common diagnoses that you see?
I'd say the biggest ones are weight loss, especially these days, and GI issues, actually. Those seem to be the two big ones.
And when you say GI issues, are we talking about things like irritable bowel? What kind of GI issues?
Yeah, IBS and GERD, the ones that, may not be life-threatening, but certainly affect a person's day-to-day quality of life.
All right. So, Kim, when you saw Ava for the first time, everyone says, "Oh, I need to eat better. That's going to help with a lot of my medical conditions." But what are some specific things that you learned from Ava that you didn't know previously?
Well, one was I was intentional about my protein intake, but I had no idea I was using outdated guidelines. So I should have been getting a lot more protein than I was in my diet. And because of the complexity of my conditions right now, it's kind of like robbing Peter to pay Paul, or, like my phosphorus runs high, but I don't have enough like calcium and vitamin D. So the things that you might think you could eat for to get more calcium might, raise your phosphorus. So all of that can get really confusing. And also I was trying to rely not so much on meat is a source of protein. But it's hard to get the plant proteins because I think beans have phosphorus. So it was like a lot. And so she helped me walk through some of that and just adding, and I also don't like a lot of additives. So even giving me like a brand of protein powder to add to my smoothies that
Mhm.
had minimal ingredients. That was definitely one. And I also referred one of my friends to Ava, and I just saw her the other night and I said, what were some of the things, that have been helpful so far for you? And she again said the amount of time, because she's a healthy person. She goes to her doctor once a year. They have so many things to talk about that they can't dive into those like nitty gritty details. And she realized that her fat intake was too high, even though she thought she was eating healthy or going with the healthy fats, that it was just too much. So those are a couple specific things that immediately come to mind.
And Kim, how many times did you see Ava over what time frame before you started noticing a difference?
Well, I actually have just seen her once, and then she sent me a list of, some recommendations and things to do. And since I already thought that I knew some things and knew how to implement them, we just went back and forth email a couple times.
Mhm.
And I'll see my doctor next month, and I suspect he'll order more lab work so we can see if the numbers have changed then.
So, Ava, when it comes to diet advice, I'm sure that you're familiar that there's so much conflicting information that is online and the social media. I talk to my patients all the time in the exam room, and there's various personalities and influencers on TikTok, and they all sell products. They all give their personal advice. So, tell us what makes going to a registered dietitian different, and contrast some of the information that you give in your office versus whatever is inundating our patients online.
Yeah, sure. So yeah, we spend a lot of time myth busting, I will definitely say. So one of the differences in seeing a registered dietitian is, for example, in the state of Connecticut, anybody can call themselves a nutritionist. There's no licensing requirements. Anybody in the room can say so. As a registered dietitian, I had to go through a whole series of coursework. I had to obtain a master's degree, do an internship, take a certifying exam, and continuing education credits in order to maintain my license. Registered dietitians, I will tell you as a whole, are fairly type A people. We tend to be very evidence-based, very research focused. And so when folks are bringing in whatever they're hearing on social media, we often myth bust through it. We'll take out the science, we'll actually explain things even down to a biochemical level of what's happening in the body in the most simplistic terms, just to try to explain how certain things are and are not making sense. And then one of the big things is also there are no quick fixes. A lot of people will come in and just say, tell me exactly what to eat, exactly how many calories, and it's not sustainable. Nobody can live their life that way. So it's really about getting the education, the groundwork, the understanding that it's not just food, first of all, right? There are a whole host of lifestyle factors. And B, it's about making it a lifestyle change for yourself that you can live, that you can still go to out to dinner or to a birthday party, but you can also live and eat, a healthy, plant-focused, protein-based diet, basically.
So, Ava, what are some of the most common myths that you have to bust in the office when you first meet a patient?
One is the quick fix. I think that's probably the biggest one. The other one is a lot of people think they have to buy a lot of very expensive supplements to be healthy.
Hmm.
And you don't. If you can eat a nourishing diet, whole food based, you can get most of what you need just through that. There are a few supplements that I do generally recommend, things like vitamin D, which are very hard. I think you said you're in New Hampshire, we're in Connecticut. It can be a little hard to get our levels up. But for the most part, if you eat a good whole foods based diet, you don't need to be spending thousands of dollars on supplements.
So, Kim, one of the things that you mentioned when you met Ava is that she has a lot of time. Like Ava was saying, that sometimes the initial consultation can last an hour or more. So, contrast that with a typical doctor's office visit with a 15 to 20 minutes. So, when you first went to meet Ava in person for that initial consultation, what was it like? And then what was going through your mind as she spent all that time with you?
Well, I love that. And that's what I thought of going home and why I wanted more doctors to know about it. Because when you go to see a doctor now, and I have different specialists, and they do an amazing job in the limited time they have. And I'm always so aware of their time constraints. You just know that you have to go in, talk about what you need to talk about, try to exchange a little bit of pleasantries like vacations, try to make something a little personal. And then that there have patients waiting for them. Where with Ava, I knew that our time was anywhere from an hour to an hour and a half. So it just felt so relaxed. She had time to really get to know you a little as a person. And she does even ask about, hobbies, like what do you like to eat? Do you like to cook? Like all of those kind of things. So it just had like a really good feeling. And you felt like she really got to know you and really tailor a plan specifically to you. And it just felt really good.
And Kim, specific outcomes. So once you implemented some of Ava's changes, tell us how that's appreciably impacted your lifestyle and maybe impacted perhaps your lab numbers and things like that.
Well, so it hasn't been all that long, so I don't know yet about the lab numbers, but also one of the things she suggested, well, basically one of the things is my cholesterol had gotten alarmingly high.
Hmm.
So she had specifically told me to add like psyllium husk. Is that how you pronounce it? Psyllium?
Same husk, you got
Okay,
it.
yeah, yeah. To like my smoothies and that with the protein powder and then also like protein bars. I wasn't sure what the cleanest brand was and I had bought a couple, but I thought they were like a little sticky so that I was getting some other ones and she's like, no, can kind of stick with the one that only has four ingredients and so just those things that made it oh, and then even like to add sometimes protein, like the protein shakes, like only what you need, OWYN, right? So just some specific things with minimum ingredients, it just gave me the confidence. So now, like if I'm doing Zooms or something and I barely have time to eat lunch, if I had like one of those shakes or protein bar,
Hmm.
I just know that I'm getting the protein and that it's still like real food and healthy. And again, it's not supplements and I'm not, running for, like the chips or something.
So Ava, I'm as a primary care doctor, as we talked about before, sometimes I don't have an hour to spend with patients, especially for common primary care conditions like obesity. So in my 15 to 20 minutes, what are some high yield tips that you could share with the other doctors listening to you on this podcast that they could impart on their patients, short of sending everyone to a registered dietitian? Is there anything that we can do in that limited time?
I think just getting into lifestyle habits a little bit if you can. I find often if you pull one thread, the other threads start to come through. So if you talk to somebody about, what foods they like to eat, if they know how to cook, who does the food shopping in their home, you can ask questions about exercise, if they get any movement in their day. Sometimes just asking people how they're feeling, are they sleeping? A lot of times folks will start even from there and let me know that they haven't been sleeping well, they're getting up, they're getting less than 6 hours of sleep a night, and then that causes them to eat a lot because then they're tired and hangry during the course of the day. So sometimes if you can just sort of pull on a couple of those lifestyle strings, people start to open up a little bit more, and they'll start to tell you a little bit more about what's going on with them. And I think for you as a physician, just having a better understanding of what their day-to-day life's really like would probably benefit you too.
So, Ava, sometimes when I bring up the a recommendation to see a dietitian, sometimes patients respond, "Oh, I know what to do. I know how to eat better. I could look it up on the web." What are some things that I can say, not to sell sending to a right dietitian, but maybe to maybe convince them, saying that, "Hey, a registered dietitian can really offer more than I can give and what they can research on their own." What are some things that I could say to these patients who are initially a little reluctant?
Yeah, sure. So, first of all, we're not the diet police. I'll start there. A lot of people come in thinking they'll say to me, oh, you're going to tell me to take away everything. And that's not true. That's not what we're here for. We're really there to spend time with them, to understand what's going on, to, try to find a couple, two to three things tops that maybe they could just tweak or work on to really have big bang on their overall health. We're there to listen. We're there to sometimes communicate to their doctors. So sometimes I know you're very busy. People go on portals, you're going back and forth or what have you. But as a dietitian, I can pick up the phone, call the doctor's office, and actually end up having a conversation and then communicate back to the patient. So we can also just sort of be that bridge between you and your physician.
We're talking to Kim Downey and Ava Safir. Kim is a physician advocate. Ava is a registered dietitian. Their Kevin MD article is Why Patients Need a Registered Dietitian on Their Healthcare Team. Now I'm going to end by asking each of you just to share some take-home messages to the Kevin MD audience. Kim, why don't we start with you?
Sure. So whether you're a patient or a doctor, you could be asking yourself, how can I feel more supported, personally and professionally? So for patients to know that there's other people out there that could be on your healthcare team to help, such as a sleep specialist and dietitians. And if you're a doctor, both personally and professionally, because we know that doctors are human and they have the same struggles that other people do. Doctors have sleep issues, and you can see a sleep specialist. Doctors come in all shapes and sizes and aren't oftentimes you very well versed in dietitian as Ava went to school for. So sometimes a doctor, it could be helpful for them themselves to see a dietitian, and then also knowing that they can refer their patients, and then it helps the doctor because, as you said when you came on my show, that we all want the same outcomes, right?
Mhm.
Patients and doctors both just want the best care for the patient. So doctors can feel good about giving that individualized care that by referring them to a dietitian. And then, of course, the patients benefit as well. So it's a win-win.
And Ava, we'll end with you. Your take-home messages.
Yeah, I think I would piggyback on what Kim was saying. My message to doctors or just health team members is let's collaborate. The more we collaborate, the more we all get more out of why we went into healthcare in the first place, which is to work with our patients and to get positive outcomes. And the more we can support each other and improve our patients' health, their lifestyle, their overall wellness.
Ava and Kim, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you.
Thanks, Kevin.